This is Crystal Fend in Orlando at the American College of Cardiology meeting, where further findings emerged from the blockbuster Jupiter trial. I spoke with Drs. Robert Glynn and Paul Ridker about the impressive reduction in deep vein thrombosis and pulmonary embolism seen among apparently healthy adults given rosuvastatin in their trial. So, Dr. Glynn, what is the real take-home message for clinicians from these findings on venous thromboembolism in the Jupiter study?
Well, in the discussion of the prevention of cardiovascular disease, the primary prevention, VTE should be on the table. It should be part of the conversation. It's an important event occurring in our study as frequently as MI and stroke. Up to now, there was no primary prevention approach to take, and so perhaps that's why it hasn't been discussed. But these data suggest that there's now a way to lower that risk, and in the context of discussing prevention of the other cardiovascular diseases, VTE should be part of that discussion.
So in this sub-analysis of the Jupiter trial, you found a 43% reduction in venous thromboembolism. Dr. Ridker, as a practicing physician, what kind of take-home are you going to take to your practice? Do you think that this will have an impact on how you use statins?
The data are really very exciting because it's not just that we have a 43% reduction in first blood clot in the legs or those that might go to the lungs. We also accomplish this with no increase in the risk of bleeding at all. That's important. Normally when we try to treat a blood clot, we give people a blood thinning medication like warfarin or heparin. That's good at reducing the risk of recurrent blood clots, but it increases the risk of bleeding. This is pretty interesting data. Here's a statin that we already know is very effective at lowering the risk of a heart attack, stroke, cardiovascular death. Has an added benefit we didn't know about in the past. It also reduces venous thrombosis. But let's be a little careful. We're not talking here about trying to prevent first venous thromboses. What we're really saying is there's another benefit overall to statin therapy that probably has been overlooked in the past, and it can be very important for some patients. Now in my clinic, things are different. In my clinic, I have patients who've had a prior blood clot. They're at very high risk for another one, and after they've been treated with an anticoagulant for a year or so, I don't know what to do. Well, now I might think about, should I give them a statin, particularly if they qualify for it anyway, and tell them not only am I going to reduce your risk of heart attack or stroke, I can now reassure them I can also reduce the risk of a blood clot. It's really very nice data.
So on a larger scope, Dr. Glynn, these findings were in a relatively healthy population. They didn't meet standard guidelines for lipid-lowering treatment and didn't have common risk factors for cardiovascular disease. How do you see these venous thromboembolism findings contributing to the debate about possible population benefits of using a potent statin?
Well, one of the ways we measure population benefits is in the number of patients needed to treat or the reduction in the absolute risks of events. And widening the perspective to include VTE, we find that there's a reduction in the number needed to treat, an increase in the difference, in the rate difference between treated and untreated patients, and therefore the therapy has a wider benefit.
Mm-hmm. Dr. Ridker, your opinion?
Well, I agree. I think that what we're finding here is that if you're asking the question, how do these drugs work and are they beneficial, we keep finding that the benefits are increasing. Many patients are at risk for venous thrombosis, those who are older, those who are heavier, some women taking HRT, and we're trying to figure out what to do. Again, though, the indications out of Jupiter really are, if your cholesterol level is low and you don't qualify for a statin, and your CRP is high, what we've shown in the greater trial is that that group's at high risk, and statin therapy is highly beneficial for heart attack, stroke, and cardiovascular death, and actually total mortality. What we're saying now is we have an additional benefit on top of that. We can reduce venous thrombosis. Once again, it really changes, I think, how we think about this. These drugs, as a class, are looking to be remarkably safe, remarkably effective, and as the cost comes down, I think the whole balance is likely to shift for our willingness to use them.
In Orlando at the American College of Cardiology meeting, this is Crystal Fend, MedPage Today.